Staff impact on budget. Staff can acutely affect the organization's finances, making accurate patient care documentation very important. Misuse of sick time, excessive overtime or turnover, and wasteful use of resources can result in negative variance. See leading at the bedside, managing resources. The manager plays a key role in explaining the unit's goals, the organization's financial goals, and how each individual is responsible for helping the organization meet those goals. Improving performance. It is important for the nurse manager to raise the awareness of staff about how critical accurate, thorough documentation is for reimbursement. For example, a nurse manager may get a call from a billing coder who asks why a patient has not been discharged. When reviewing the documentation, the coder notes normal vital signs and that the patient is ambulating and has showered. Improving performance. When one staff member wants to take time off, the shift still must be covered. Nurse managers must hire enough staff to cover the unit when people are on vacation without using excessive overtime. Float pool or PRN staff scheduled on an as-needed basis, are often used to cover staff time off. Managers must plan how to cover each employee's non-productive time, e.g., vacation, sick days, education, in the least expensive way. After discussion with the nurse about the patient, the nurse manager learns that the patient had been vomiting, did not eat breakfast or lunch, and has not urinated today. This information was not documented in the patient's chart by the nurse. By documenting accurate care activities, the nurse can demonstrate the rationale for why the patient is still in need of hospital care. Magnet hospital performance. In Magnet certified hospitals, staff are taught about budgeting and how the unit's money works. Bedside staff make excellent, informed decisions about what resources should be used, and understand the give and take of budget management. Bedside staff are empowered to make decisions that impact how they work. For example, the charge nurse on the unit takes phone calls about unit staffing. The float pool might have an additional aide coming into work who is not assigned yet. The charge nurse takes the call from the staffing office to ask if the unit needs another aide and makes the decision. Nursing relationship. In patient care. Nursing care is one of the largest expenditures in healthcare organizations. Welton and Harper, 2015. Being in tune to the patient population the nursing staff serves is as important as planning the budget for the nurse manager. Many aspects of nursing care are not captured in the hours per patient day, HPPD. Caring, empathy, trust, and building a relationship with patients are all important pieces of the nursing relationship. As well, the intensity of care for one patient on the unit may be higher than the intensity of care for another patient with the same diagnosis. Jenkins and Welton, 2014. Understanding these complexities of nursing care can help a manager perform better.